Okay, it looks like we are recording. Hi, my name is Andrea Stevens, and
I'm Everett Brown.
all right, and we're doing our journal article recording for Mrs. Dinky and her mental health class in spring 2019. Um, so Everett and I decided to kind of take a look at benzodiazepine use. It had been mentioned a few times in our clinical group with our instructor, and one thing that I found out that I probably didn't remember from pharmacology is that there are some major withdrawal symptoms, and she was talking about how in her practice she likes to really use them judiciously to avoid those side effects, and also, like now, with the opioid epidemic, I guess benzodiazepines also go hand in hand because a lot of people are misusing these and could be stealing prescriptions and stuff. So we looked at a 2015 study posted in the Journal of the American Medical Association. So in this study, it was a retrospective descriptive analysis, and basically the authors wanted to kind of get a handle on what were the current rates of use in the U.S. and who was using them and for how long. So to do this study, they had queried the LifeLink RX database, which contains 60% of all retail prescriptions in the United States. They looked at all of the people that had been prescribed benzodiazepines, which was um, about from the adults that were aged 18 to 80, 5.2% of people in that database had been prescribed at least one benzodiazepine in 2018. So in hardcore numbers, that 5.2% of all the people in that database accounts to about 11,491,677 of the full 219 million in the database. So I mean, even though the numbers that we're about to talk about look small, if you blow this up on the population scale nationwide, it's a huge number of people that are currently prescribed these things. So to get a look at what was going on with who and why people were being prescribed these, one thing they looked at again is they broke down the use by male and female and by age ranges. So they looked at a few different age ranges. The age range we're focusing on is the elderly. So that's going to be those in the age of 65 to 80. The results, rates of use were higher among women than men generally. And that held true even with the older adults. And in total, if you look at male and female, broken down by age group, the older adults, male and female, had higher rates of use. And they also were more likely to be using these benzodiazepines in the long term, which in the study was described as people having prescriptions for 120 days or more. So, like I said, we were really wanted to focus on older adults. So there are some well-known risks associated with older adults using this class of medication. Some of those risks are impaired cognitive functioning, confusion and or paradoxical agitation, reduced mobility and driving skill, increased risk of falls, which are all things as nurses we really don't want to see in our elder population. And another thing that they noted in the study is that as age increased, the patients were less likely to have the benzo prescribed by a psychiatrist, which I thought was very interesting. And another little nugget gleaned from this research is that they found that many of the prescribers did not think the long-term use was negative, and many of those prescribers were actually not psychiatrists, like I said, but were their PCPs. And I'm not trying to bash PCPs, but they're probably not going to have as good of a handle or appreciation of the full power of these drugs as a licensed psychiatrist would. Okay, and I'm going to hand it off to Everett now.
All right. So the older adult bracket, which we were looking at, which was 65 to 80 years of age, um, for those that were using benzo, 66.1% were men and 10.8% were women. The highest rate noted in the study was among 80-year-old women, and that was 11.9%. Now, roughly 75 million benzodiazepine prescriptions were written nationally in 2008, which is the data that the study looked at. Uh, so, according to our book, between 3 and 4 months, after 3 and 4 months of use of benzos, if you were to stop using them, you will start seeing withdrawal symptoms. And some of those withdrawal symptoms would include insomnia, irritability, nervousness, dry mouth, tremors, convulsions, and confusion. Um, so when an older patient is taken off benzos, they have to be carefully monitored to avoid any negative effects on ADLs. Some of the ways that benzos can be supplemented or can be offloaded from addiction, benzo addiction, is cognitive behavioral therapy. And some of the non-pharmacological options or sleep hygiene, which is kind of similar to watching TV late at night in bed or reading in bed. So we want to keep that area as a sleep zone area. Um, Also, we want to limit stimulus. So when you go to bed, it's good to turn the lights off and not have a light on so that your body recognizes that it's time to go to sleep. Another way is relaxation training, so like meditation, to get you in the mood of getting your body to slow down and get ready for sleep. And the fourth way is through exercise, and that is going with sleep hygiene. You do not want to exercise 2 to 3 hours before you go to sleep. So if you're going to exercise, that needs to be done well in advance of sleep time. So those are the things that we looked at in the study. If you have any questions, please post to our discussion and ask. Thank you.
Thank you. Bye bye.